Tonight, meet just a couple of the many hospitalists who work with community patients. As we mentioned, these physicians are fully trained, board certified, and able to treat and diagnose patients. Instead of a doctor's office, their place of practice is at the hospital. It's a relatively new medical specialty, but it's one that has gained attention for providing more consistent and immediate care to hospitalized patients.
Hi Howard, how are you doing today?
Dr. Uma Rao is making the rounds, checking on patients at Community Regional Medical Center.
You a little sore here?
Yeah. Dr. Rao is one of many hospitalists now practicing hospital medicine at Community Medical Center's 3 acute care hospitals.
His vital signs over the last 24 hours have been excellent.
As hospitalists, these doctors are fully trained, board-certified physicians who opted out of a private practice to treat only hospitalized patients.
We're able to provide services that an outpatient physician cannot. Basically, we're here to answer any patient's questions or concerns, or the nurse's questions or concerns right on the spot.
Since hospitalists work from within the hospital rather than an outside office, a doctor is always available to give immediate care to patients, to coordinate with specialists, and to order any necessary tests or lab work.
Another deep breath.
At Community Regional Medical Center, patients benefit from this type of specialized care with shorter hospital stays and lower medical care costs.
The role of the hospitalist is to admit the patient, treat them, and discharge in an effective, efficient manner. And so the better we do this, the easier it is to reduce the length of stay. And a lot of the healthcare costs are in hospitalization.
The patient care is something that is just taken to the next level. We really keep the patient as the primary focus.
Since hospitalists are still a new specialty, it's hard for some patients and even some doctors to understand their role.
Oftentimes, too, they're very surprised. They think we're residents or we're even nurses. They're not quite sure of what to make of a hospitalist. So that's why I've kind of made it a bit easier for them, and I tell them I'm your inpatient physician. And then they say, well, why can't my doctor come in? And I tell them it's just because of logistics and time, and it's very hard for their doctor on the outside to just round on them quickly during lunch or after work. So we're there to help them out the whole time.
The term was first coined in 1996 by Dr. Robert Wachter from UCSF in San Francisco. And since then, the specialty has become one of the fastest rising specialties in medicine today.
Hospital medicine emerged to help primary care physicians manage busy office schedules and the needs of hospitalized patients.
They needed doctors to cover their hospitalized patients, so they contract with hospitalist groups to provide that service for them, so that the patient is treated in the hospital and then discharged back to their care. And that allows them to focus on their outpatient office practice.
Seeing patients only in a hospital brings with it unique challenges.
I see a lot of patients who do not have primary care physicians, who come in with chronic conditions that haven't been treated because they don't have outpatient physicians. So they come in extremely sick and need very intensive type of specialized care.
But with those challenges come the benefits.
I personally like having the supportive services around me. As an outpatient physician, you don't really have that. It may take you several days to get labs back, several days to get imaging studies back, whereas everything in the hospital is done immediately.
Hospital medicine allows me to work very closely with so many different specialists, and I feel like I'm always on my toes because I learn so much every day, and it is just such a pleasure to interact with all specialties in medicine. They're just right at our fingertips.
With growing demands for medical care and concern over rising health care costs, these doctors, as hospitalists, know they are on the leading edge of new trends in medicine.
It's nice to know such qualified, caring, and dedicated physicians are on your side during your stay.